And in what appears to be a silver lining at this point in time, the Health Ministry has hinted that the third wave could possibly be ebbing. In fact, early indications of cases plateauing is what the centre has said, especially in certain regions. The plateau is being seen already, but the trend needs to still be observed. Precautions need to continue as well. Meanwhile, also important data that 10 states are contributing to 77% of the active cases at this point. Ayushman joining us for more on this. Ayushman, if you can take us through some of the important points mentioned in that Health Ministry briefing. Small silver lining here that we could possibly be seeing a plateau as far as the third wave is concerned.
Yes, an important evidence that has been given from the Health Ministry side, and key evidences which are emerging. It suggests that 10 states are contributing about 77% of the total active cases in India. And more importantly, out of these 77% cases, 90% of these cases are there in home isolation, which means they are in mild and asymptomatic category. More importantly, the clear trend is also there in lower cases needing oxygen support, and also ICU beds occupancy is observed. It is also being said that vaccination is somewhere supporting the current infrastructure of health, and more than 90% of the cases, the active cases which are there, they are currently in the home isolation category. There is a report of less severity. In fact, the comparison from second wave to third wave was also given. The coverage of vaccine was minimal at that time. This time it is more than 74% of the eligible population has got both doses. So crucially, it is being said that the cases are plateauing, and they also, Omicron has become the most dominant variant right now. If you see the overall number of cases that is present, so genome sequencing is suggesting that Omicron's dominance is there, and also the plateauing of cases is there. So it is a silver lining that is being observed. But of course, it is the early indication that are there. It needs to be continuously followed, and trends need to be seen from different states in the coming days.
All right, Ayushman, thank you so much for joining us with all of those details. But let's bring in another voice and some more perspective here. Dr. Anil Dhal, cardiologist, is joining me here on the broadcast. Thank you so much, Dr. Dhal, for joining us. Your own perspective when we are looking at a possibility of the third wave ebbing. The fact is, in a country such as India, we are seeing cases rising and falling in different parts of the country at different times as well. So how does one assess the third wave ebbing?
I don't think that there is any rocket science or any predetermined way by which we can find this out. But one thing I must say, it was as per prediction from what we learned in South Africa that the urban surge would ebb by the third week of January to the second week of February. This was predicted as far back as in end of November or early December. Because once we have a positivity rate of around 30-35% and remarkably high transmissibility, it is bound to create a certain amount of herd immunity, which is bound to thereafter, along with the benefit vaccinated community, is bound to decrease the number of cases that we have. So I don't think we should we should think of this as something strange which has happened. This is just an epidemiological course which it has taken. And the problems are twofold. Number one, that this has happened in the metros. What will happen in the hinterland may be a gap of a few days to a few weeks. For example, even during the second surge and during this surge, Delhi was about 7 to 10 days behind Mumbai. So what will happen in the hinterland, we do not know. Whether it will lead to, because there is some talk about Omicron reinfections, whether it will lead to a recrudescence even in the metros, we have to be watchful. We should not rejoice, but we should know that this is going as per plan.
Yes, in fact, Dr. Dal, that was going to be my specific question in terms of, how confident can we be that just because the cases are, falling in specifically in the metros, that given the fact that we might see cases rising in other parts of the country, could it then not come back and we might see a resurgence of cases of sorts? But if you could just elaborate on that a little bit, how does one or how do we as a country navigate this particular situation at this point in time and make sure that we are not easing up on certain restrictions too early at the same time?
I think we have to continue to be mindful of COVID appropriate behavior in letter and in spirit. And we should take care that the big melas and the big celebrations and the big events that we have, we continue to maintain distancing and masking during that. Uh, we have to continue the efforts that the government has made in immunizing or vaccinating as many people as there can be. But all this is for the existing mutations that as we know of. If there is another variation or another mutation, well, that'll lead to another set of predictions. But by and large, let us not play astrologer, and it's just if we play just doctor. We know that it was anticipated that when the positivity rate of a highly transmissible infection reached about 30-35%, it was bound to drop. And for it to not come back from the hinterland to the metros, we have to be watchful, we have to exercise complete caution, and we have to be mindful of all our protective measures. The proverbial thing between lives and livelihoods, we understand this is a mild infection, and therefore one should resume normal life, but with maturity and discipline.
Right. Dr. Dal, request you to please stay with us, talking about resuming normal life. There are other aspects also that I want your views on. But before that, let's also listen into what the Health Secretary had to say a short while back. Play that out for you in just a minute. But meanwhile, let's also talk about the national capital as well. Relief coming in for Delhi residents. There won't be any more weekend curfews in the national capital, or even curbs also have been removed. Restaurants and cinemas can open at 50% capacity. Number of guests at weddings has also been raised. In fact, colleges and schools, meanwhile, will remain shut for now. So this is the situation in Delhi at this point in time. Earlier, Delhi Deputy Chief Minister also said that at least 1,600 parents in a memorandum had demanded that schools be reopened. Alok is joining us here for more on this. Alok, give us a sense of the new rules in Delhi, the easing up of curbs at this point in time.
See, Avni, it was a long wait for the people of the Delhi because the cases have started coming down, and in fact for past 1 week, many of the things which are supposed to be opened were not opening, and in fact we saw the market association coming out on the streets and holding protest against the LG's decision. In fact, last week we saw that there was a standoff between the Lieutenant Governor and the Delhi government over the opening of the markets. In fact, 50% of the markets were opened, but right now the odd even scheme which was implemented in the markets are now, in fact, now have been lifted. The ban on the markets have now been lifted. Now the full market will be remained open from now onwards. Weekend curfew has also been now lifted. Apart from that, 50% now the hotels as well as restaurants and bars. This is good news for them that they can now call 50% of guests. They can allow 50% of guests in their premises. And also now the government offices can work with 50% of capacity, and marriages, now 200 guests are allowed in the marriages. So these are the relaxation given after today's GDMA meeting. The cases have come down in the national capital. Peak has already crossed. Around 28,000 peak had gone. But now the cases are around 10,000 only, and the positivity rate has also around only 10%. So big relief for the people of Delhi. and most of them are welcoming. But on these schools, the schools and colleges will remain shut. The next meeting will decide. The next meeting of DDMA will decide whether the school to be reopened or not. So this is what the situation is in the national capital. Back to you.
Right. All right, Alok, thank you so much for joining us with all of those details. A quick update on Mumbai as well. Cases have fallen quite significantly and the positivity rate also has come down quite a bit. It's below 5% now, in fact 4.39% as of Wednesday. Experts in the government, in fact, have been saying that the number of positive cases in Mumbai have been dropping, and the city recorded about 1,858 odd cases in 24 hours. So let me go back to Dr. Dhal here. Dr. Dhal, just taking forward your points there about resuming normal life with COVID-appropriate behavior, that's extremely important right now as well. But what would you say as far as the vulnerable groups are concerned, whether we're talking about people who have comorbidities and are vulnerable to the infection, whether it's senior citizens, pregnant women? How does one navigate this kind of a scenario here where the infection could possibly be slightly milder than the Delta version, but at the same time there is a move to try and normalize life as well?
So you make a very interesting point here, but the point is that the vulnerable population has to take precautions. And believe me, discipline can either be imposed, for which then there will be protest marches, or it can come from within. And I think the media has a very important role here, because the media should actually sensitize the public to ensure that each one of us takes more diligent precautionary measures for ourselves. The more we are protected, the less we will get infected and less we will transmit. So I think the peak, as we say, the humongous transmissibility caused a widespread infection, a rampant infection. Fortunately, it was mild. We did not have too many untoward effects. The ghastly proportions which we faced in Delta Plus did not happen. So I think we should just take wise counsel, maturity, and responsibility, and by which each individual, if each one of us decides that, listen, we are going to save ourselves, and especially those who are vulnerable, their caregivers, their families, ensure that they are looked after, I think we will be seeing better days soon.
Right. And of course, the other aspect is, things like weekend curfews and keeping schools and colleges shut, which several states also have been imposing every now and then. Obviously, these are things which a lot of experts believe that may not be the right way to go, because weekend curfews or, night curfews don't really make any difference either way.
So the coronavirus does not actually say that it'll infect only at night. I mean, these are only ways and means of ensuring that we don't have too much of human collection together. That's about it. So let's not misunderstand these rules. And at the same time, let's look at some of the other countries and what they have done. I know after the furor in UK, they have had a complete liberalization. I think the middle path is the best. And that is that we act with responsibility. Don't be too hasty in doing things. Take baby steps, take step by step, each day as it comes. Re-evaluate the data that's available, re-evaluate the genomic analysis that's available. I understand that it's gone as per the script so far in the so-called third wave. But like I said, one has to understand that the future is not known to anybody.
Dr. Dhal, thank you so much for joining us with your perspective. Some very important points there coming in from Dr. Dhal about how we need to navigate the situation in the current scenario as far as COVID is concerned.